BCABA, Board Certified Assistant Behavior Analyst. To gain certification, you must have a bachelor's degree in psychology, education, or a related field with certain ABA course requirements. You must have at least 1,000 hours of supervised ABA experience. You must pass a BCABA exam. And you must pay registration fees. Once certified, you must meet with a BCBA for at least 1 hour a month. Must be supervised by them. You cannot practice independently. You must renew annually and recertify every 3 years. Although that may be changing now, it may be every 2 years. Go to the board website for any updated information. Continuing education or CEUs are required. BCBAs, Board Certified Behavior Analyst. To gain certification, you must have a master's degree in psychology, education, or related field with ABA course requirements. At least 1,500 hours of supervised in-field ABA experience. You must pass the BCBA exam. You must pay the registration fees. And once certified, you have no supervision requirements. You can practice independently. And you must recertify currently every 2 years and have at least 35 or 36 CEUs. The BCBAD is the same as the BCBA, and you have a doctorate requirement. It also must be recertified every 2 years, and continuing education is required. Dr. Will Brandon, our owner and CEO here at Learning Arts, is the BCBAD for this company. As a registered behavior technician, you will be required to have a monthly supervision tracking form. This will be used in the event that you are audited for your hours. It is your responsibility as the RBT to seek out supervision from the behavior analyst in your area. The behavior analyst in your area may attend team meetings or overlap, but it is your responsibility to set up RBT supervision. So, evaluations that Learning Arts will be giving you. The RBT competency assessment. This will be given to you by the BCBA in your area. We'll also be doing an in-field evaluation. The RBT competency list can be found at bacb.com. The RBT competency assessment can also be found there. Once you have completed the 40-hour classroom training, you will receive this assessment. After passing, you will take this assessment once a year. This assessment will be given by either the BCBA in your area or the BCABA. Some of the items you will need to demonstrate and some of the items you will need to answer questions about. This assessment is based on the RBT task list. Understand that this assessment will probably be given when you are actually working as a trainee, as it will require you to demonstrate some of these skills. There are multiple subjects on the RBT task list. Likewise, there are multiple subjects that will be given as a competency. Becoming an RBT. You must pass the RBT competency assessment. You go into your BACB gateway on www.bacb.com and apply online. You then select the BCBA who gave you the competency exam. The BCBA that gave you the competency exam will provide you with their certification number. You then must register and pass the RBT exam. Learning Arts will verify that you have completed this training and passed the assessment and passed the training, or passed the exam rather. Then you will send in your official high school or college diploma or transcripts. And once received, you will be an RBT. Some of these directions may be outdated by the time you hear this. For example, at the current time, the diploma or transcripts may be asked during the application process. The point, though, being that you will be doing this to the BACB Gateway. So if you have not, please register there. Then you are a registered behavior technician. Again, there are two training components: a 40-hour classroom training and the in-field training. The in-field training is incredibly important. You will be overlapping with experienced techs and have a number of expected hours per week. Each day that you are training in the field, you will be expected to do certain things. You should never have anything or a day when you're not doing anything as far as working when you're training. This is a vital component of the in-field training. If you imagine flying on an airplane, would you rather have a pilot who passed all the exams and just did academic work? Or would you want the pilot who can do all that plus had a little bit of experience flying? So the in-field training will allow you to do this in a real-world setting. It is very difficult to figure out all that you need to know about ABA from just reading and looking at these slides. It will be vitally important in your in-field training to apply this information. Every day that you're training in the field, make sure you have your Learning Arts ID badge, your toy bag, which we'll go into a little bit later, and some sort of in-field folder so you can take notes. So note on toy bags. I'm not going to go over each point in this slide, but just understand that if you have some toys from home or know someone with some toys, just have some sort of goodies for the kids or for the patients that you're going to be working with. Okay? These are to stay with you. What you're trying to do is make yourself paired with those toys, with that fun stuff, so that the individual will want to approach you. So, what exactly is a behavior technician? A behavior technician is someone who implements program chosen by a behavior analyst or a behavior specialist as a one-to-one tutor. You will be taking data on patient behavior and programs. You will be communicating with specialists and staff trainers, and occasionally the analyst. Your job is to enrich a child's learning environment by increasing opportunities to learn, teaching new skills, maintaining mastered skills, and also working on behavior management. It is a very important job. As a behavior technician, you are the primary teacher for the skills that we've identified for the child or the individual to work on. There are some guidelines for responsible conduct as a registered behavior technician. You are to maintain integrity. You are to maintain both professional and scientific relationships. You are to avoid dual relationships and conflicts of interest, and avoid exploitative relationships. Learning Arts uses principles and techniques developed and tested from the science of applied behavior analysis to increase the child's abilities in the area that autism has affected. What is Applied Behavior Analysis, ABA. It is a science devoted to the understanding and improvement of human behavior. Applied behavior analysis focuses on objectivity and objectively defining behaviors of social significance. It uses the methods of scientific inquiry, objective description, quantifications, and controlled experimentation. In other words, it is a scientific approach for discovering environmental variables that can reliably influence socially significant behavior and for developing a technology of behavior change that takes practical advantages of those discoveries. All those fancy words just mean that we are looking at significantly changing the behaviors of individuals in a targeted and systematic way that will help them to live a more independent and fruitful life. So a little bit of background about attitudes of ABA. Determinism says that the universe is lawful and orderly. Empiricism says that there's objective observations are superior to subjective observations. Experimentation, carefully conducting comparisons to the use of objective observations and data, are the best way to document phenomena of interest. Replication, the results of a single experiment, no matter how well the study was designed and conducted, and no matter how clear and impressive the findings, are never sufficient to earn an accepted place among the scientific base of any field. So you need to be able to do it again, essentially. Parsimony, the simplest explanation should be ruled out before considering more complex or abstract explanations. Or in other words, the theory with the fewest assumptions is typically the one that is gone with. Okay, so parsimony is that usually there's fewer assumptions. Philosophic doubt. A true scientist must always continually question the truthfulness of what is regarded as fact. Behavior analysis origins. B.F. Skinner wrote The Behavior of Organisms in 1938 and revised in 1966. This formally began the experimental branch of behavior analysis and summarized his laboratory research from 1930 to 1937. It discussed two types of behavior, respondent and operant. Respondent behavior is reflexive in nature. I shine a light into your eye, you might blink. I show you a favorite dessert, you may begin to salivate. I puff air into your eye, you may blink. They're reflexive. You're responding to the stimulus. You don't need to be trained to do so, it just occurs. Operant behavior, on the other hand, occurs due to the consequences that follow it. Behaviors are influenced by stimulus changes that have followed the behavior in the past. If I press a power button on my phone and it turns on, I am more likely to do that in the future when I want to turn my phone on because of the consequence. The phone turned on. This is very important to consider with the patients that we'll be working with. A lot of behavior that they're going to exhibit is operant because it gets them something. I have worked with several individuals who tantrum to get out of work. This is known as escape behavior. It is also operant because the behavior is being shaped by the consequence. In their learning history, if they tantrum when they're asked to do something, they are let out of the task. So it is our job as the behavior analyst and RBT team, rather than give them what they want by tantruming, which is a break, we're going to teach them rather to ask for a break appropriately. This is known as replacement behavior. We'll go much more in depth to this throughout this orientation, but just know that is operant behavior. The person is tantruming so they can get a break. We're going to use that knowledge to our advantage, and we're going to give them a better way to ask for a break This type of replacement behavior will allow the person to still get what they want through the operant, but in a more appropriate manner. You may be familiar with studies done, such as the Pavlov study, where he rang a bell while showing food powder to the dog, or having the dog smell the food powder. This was respondent conditioning. He did not have to train the dog to do that. Operant conditioning, on the other hand, is when the rat or pigeon in the Skinner box would press a lever and they would get food. They would have to be taught to press the lever because of the consequence where the food pellet dropped. So, what is so awesome about ABA? Well, it's effective. It is backed by a lot of research. Okay, those two go hand in hand, right? We're not just saying it's effective. It has been backed by a lot of research. The nice thing about ABA is that with enough training, it can be used by anyone. The rules of applied behavior analysis are universal and apply to everyone, even you. You can take any situation that you've done, any behavior you've done, and we can analyze it and see why, through the functions of behavior, you may have acted in that way. Okay. There's also a ton of opportunity in the field. BCBAs are in pretty high demand, and we're pretty well paid. So, what are some of the backbones of ABA and ABA therapy? Well, first we're going to go over the ABCs of behavior. All willful behavior happens in an ABC fashion. A, meaning antecedent, B, meaning behavior, and C, meaning consequence. It is imperative that you memorize this. This will be one of your best tools to help you in the field. Again, applied behavior analysis uses ABCs: antecedent, behavior, consequence. Let's talk about B, the behavior. Okay? What is behavior? Behavior is anything that a person or an animal can say or do. It is something that can be observed. So can you name some behaviors? Okay. Think about in your life what behaviors you engage in. Remember, behavior is not a bad or good thing, it's just what happened. Some behaviors can be witnessed by others. We call this overt behaviors. Some behaviors cannot be witnessed. This is called covert behavior. Covert means hidden. Overt behavior is any behavior that can be seen, heard, felt, tasted, or smelled by another person. Yelling, eating, talking on the phone, writing, making coffee, drawing, playing video games, etc., etc. Those are all overt behaviors. Covert behaviors are any internal behaviors that cannot be observed through any of the five senses by another person. Daydreaming, feeling nervous, thinking about coffee, those are all covert behaviors. So reading a book, is that overt or covert? Dreaming, overt or covert? Asking for a cookie, drinking water, pointing at the cat and saying cat, thinking, or feeling angry. So reading a book is overt behavior. You can observe a person doing that. Dreaming, this is covert behavior. We can't see if a person is dreaming or not. Asking for a cookie, this is overt behavior. We can see when a person, and hear when a person is asking for a cookie. Drinking water, also overt. Pointing at a cat and saying cat is overt behavior. We can see and hear them do that person do that. Thinking is covert. We cannot see what a person is thinking about. Feeling angry is also a covert behavior. We can tell some of the behaviors that go along with feeling angry, but we don't know if a person is actually angry or not by just simply looking at them. Now, there may be some of you who disagree with some of these. For example, someone might say dreaming could be an overt behavior if you watch the eyes, the rapid eye movement. And while that may be true, all that rapid eye movement is telling us is there's certain brain waves going on. So, and I would argue sometimes that even reading a book, I might argue could also be covert behavior, because holding a book certainly is overt behavior. You can see someone holding a book, but I'll argue sometimes that it is actually reading is actually a covert behavior, because you can't actually tell if a person is reading. But we're just mincing words at this point. The point is that for the vast majority of the behaviors we're going to be looking at, they're going to be overt. It's stuff that we can see. Okay? Because in this field, we tend to only focus on the overt behavior. Why? Because it is something that we can observe. It is measurable most of the time. If you can see it, then we can try to measure it. And if we can measure it, we can see if our intervention is working, or if it's not working, and if we need to change something. It is not to say that behavior analysts don't care about covert behavior. It's just that there's no way to really measure it or work on it through some of our techniques. It is important to note, though, here that if there is some covert behavior that is troublesome, such as if a person is thinking about, for example, hurting themselves or hurting others, as a behavior analyst, I have the ethical responsibility to refer them to other agencies that may be able to help them with that, such as counseling. So it is not to say that we do not care about covert behavior. It is just that in our field, we tend to focus on overt because we can measure it and we can observe it, and we can work on it through techniques of ABA. So let's talk about some rules about behavior. We do tend to only focus on overt behavior. These behaviors follow specific patterns or natural laws. All behavior is influenced, changed, and shaped by the environment. If we can control or influence the environment, we can control or influence the behavior. Some natural laws of behavior. Behavior can be increased through reinforcement. Behavior can be decreased through punishment. All behavior has a cost in energy, so it has a cost to the person in how much energy they have to expend to do that. As human beings, we tend to behave in ways that gain us the most reinforcement for the least amount of energy. So to illustrate that, if I have $10 to give to one of my kids, and I ask him, would you rather have $10 to clean your room or clean the house? They'll probably pick the room. I would say probably 99% chance they would. Why? Because they get the same amount of reinforcement, the $10, but they have to expend far less energy just cleaning their room versus cleaning the whole house. It is very important to keep that in mind working as an RBT as you work with patients who may have severe behavior issues to try to gain access to stuff, and to understand that if they have had these behavior issues to gain access to things, it is probably easier for that person, that patient, to do that behavior rather than to ask appropriately. So it is important to remember to work out the good behavior, to prompt and help them with the good behavior, and to ignore that bad behavior so it can be more effective for them. Again, we'll get into more detail later, but just understand that we as humans tend to do things that gain us the most reinforcement for the least amount of energy. So if we can control the environment, we can control or influence that behavior. But how do we control the environment? And let me stop for a second and tell you what the environment is in our terms. The terms that we're talking about today, the environment doesn't mean just the outside world. It means any environment that you're in. For example, I am sitting in a small room right now. That is my current environment. Within this small room, there are chairs and desks. We go back to the ABCs when we talk about how do we control or influence the environment. In general, we control the before and after within the individual's environment. For each child that you're going to work with, for each patient that you're going to work with, your success with them relies on two things. What you say or do to set up the opportunity to learn, and what you say or do after the opportunity to learn. Remember, you control the before and after. So what do we mean by control the environment? Our job is to control the antecedents and the consequences. So, let's talk about C now, the consequences. Let's talk about consequences. Any condition that follows a behavior. Now, in our society, the term consequences typically denote a bad thing. In applied behavior analysis, it is simply any condition that follows the behavior. It is neither bad nor good. It is just what happens after the behavior, following the behavior. For example, some common consequences are a reward, a treat, a smile, a praise. Some other common ones that are negative are shocking, slap, scream, getting yelled at, being told no. Another common consequence is getting what you asked for. If my son Simon says, "I want a cookie," I hand him a cookie. The consequence was him getting the cookie. Turning something on or off. If I press the power button on my phone and it turns on, the consequence of that was the phone turning on. We know that certain consequences can increase or decrease the likelihood of the behavior that they follow. Manipulating consequences is one of the most effective ways of changing behavior. As an RBT, you will be asked to collect consequence data in ABC data collection. What we're trying to do there is figure out the function of the behavior. What are the consequences that are most common when the behavior occurs? This helps us to identify what consequences we can use to increase or decrease other behaviors. It lets us know how ingrained that behavior is, how long the person has been doing it, or how resistant it is to change. Let's talk about A, antecedents. A fancy term for what happens right before the behavior. An antecedent is a term used in behavior modification that describes a condition or action that occurs immediately before a behavior. Some examples of possible antecedents are an instruction or a demand, presence or absence of people, things, noises, environmental changes such as a weather or alarm clock going off. Controlling antecedents is one way to influence behavior. It may not necessarily be as strong as controlling the consequence, but it can be very effective. For example, if I know one of my clients has major tantrums every time he sees a balloon, I will make sure that there are no balloons in the house before starting to work with him. Or if I know that I will eat 10 cookies, if there are cookies out on the counter, I might put those cookies away. As an RBT, you may be asked to gather antecedent information. This will help us to predict when a behavior is likely to occur. It will help us to evoke a behavior using known antecedents. And it will decrease the chance that a behavior may occur in the future. Those are all reasons we may ask you to start taking antecedent data. In this example, let's look at what the ABCs are. A child is sitting in a shopping cart as his mother shops at the supermarket. The cart passes by the cookie section and the child starts screaming, "I want the cookies." His mother takes a pack of cookies off the shelf and puts the pack in the shopping cart. The antecedent would be that the cart passes the cookie section. The behavior would be the child screams, "I want the cookies." C, the consequence, the mother puts the pack of cookies in the shopping cart. Let's try another. It is 7 a.m. and your alarm clock goes off. You reach over and press the snooze button. The alarm silences. The antecedent is that your alarm clock goes off. The behavior is that you reach over and press snooze. What's the consequence? The alarm stops going off. Remember your ABCs. This is one of your best tools in the field. If you ever feel stuck, knowing the ABCs will help you figure out what to do. For example, if the person you're working with is engaging in a behavior, a problematic behavior that you do not yet know or have identified, think about what the triggers were. Think about what the antecedents were. And think about, what is this behavior getting this person? What does this behavior get them? What is the most common consequence? You won't be able to figure it out right then and there, but by knowing what the triggers are and trying to think about what the person is getting from the behavior, it will help you to address it. So this is an important skill to gain, to start breaking down behaviors in these three-term contingency, the ABCs, to recognize what common antecedents are and what the common consequences are. So here are some review questions from this presentation. What are the 3 items needed to gain an RBT credential? 40-hour training, RBT competency exam, RBT exam, all of the above. The correct answer is all of the above. The 40-hour training, the competency exam, and RBT exam are the 3 primary steps to become an RBT. What does RBT mean? Registered Behavior Technician or Requested Best Topographer? The correct answer is Registered Behavior Technician. RBT stands for Registered Behavior Technician. Who certifies RBTs? Is it the BACB, the RBT manager, a BCABA, or a specialist? The correct answer is the BACB, the Behavior Analyst Certification Board. This is the entity that certifies RBTs. What does BACB mean? What does the letter stand for? Is it behavior or consequence based? Is it Board Analyst Certified Behaviorist? Is it Behavior Analyst Certification Board? The correct answer is the Board Behavior Analyst Certification Board. Again, the correct answer is Behavior Analyst Certification Board. BACB means Behavior Analyst Certification Board. Once certified, what percentage of the hours in a month need to be supervised by a BCBA? The correct answer is 5%. This next question is a true or false question. Or yes or no, rather. Are you able to practice independently? Yes, you do not need anyone to supervise you, or no, you must be supervised by a BCBA. The correct answer is no. You are not to practice independently. You must be supervised by a BCBA. What is the role of the RBT? To implement programs chosen by the behavior analyst as a one-on-one tutor, writing assessments, designing and implementing programs and then getting them approved by your supervisor, or making pizza. The correct answer is to implement programs by the behavior analyst as a one-to-one tutor. The RBT does not write assignments. The RBT does not design programs. Although an RBT may make pizza, that is not their role as an RBT. I like to make pizza myself. What is ABA? Is it Associate Behavior Analyzing? Applied Behavior Analysis? All Badgers Alienate? Or Applied Behavior Articulation? ABA means Applied Behavior Analysis. ABA is science-based. True or false? The correct answer is true. ABA is science-based. What does ABC stand for? Does it stand for Applied Behavior Center? Analyzing Behavior Concerns? Antecedent Behavior Consequence? Or Always Bathing Chimps? Well, I can be pretty certain it doesn't mean always bathing chimps. ABC stands for Antecedent Behavior Consequence. Overt behavior is behavior that you cannot see. True or false? That is false. Overt behavior is behavior that you can see. Touching your head is an overt behavior. True or false? True. Touching your head or seeing someone else touch your head, both can be observed. In ABA intervention, we focus on overt behavior. Why? It's observable and we can measure it. We can see it. Is the answer both A and B, or none of the above? The answer is both A and B. Overt behavior is something we focus on because it is observable and we can measure it and we can see it. Behavior can be increased through and decreased through. Behavior can be increased through reinforcement and decreased through punishment. We behave in ways that get us the most reinforcement for the least amount of consequences, punishment, apples, or energy. The correct answer is energy. We behave in ways that get us the most reinforcement for the least amount of energy. If we control the blank, we control the blank. Is it behavior in person, environment or behavior, pickles and sandwich, or behavior and environment? The correct answer is environment and behavior. If we can control the environment, we can control the behavior. You will also be asked to do these exam questions at a separate time. Okay, this is the last one for this one. Sorry, thought the last one was. Here we go. For each patient you work with, your success with them relies on what you say or do to set up the opportunity to learn, and what you say to them before the behavior, providing a favorite toy before session, having them play up until the opportunity to learn, what you say or do after the opportunity to learn, or eating a pizza. The correct answer is what you say or do after the opportunity to learn. For each patient that you work with, your success with them relies on what you say or do to set up the opportunity to learn, and what you say or do after the opportunity to learn. Remember, what you do before is the antecedent, what you do after is the consequence. You control the before and the after. So, antecedents come. Do they come before the behavior, after the behavior, during the behavior, or only during intervention? Well, hopefully you've been paying attention and understand that antecedents come before the behavior. And consequences come after the behavior.